All right. Well, it's a good day today in that we are welcoming Chief Craig back to work full-time, and he's going to get a chance to address you. But I want to start by acknowledging two of our fellow city employees who haven't made it back. Claudia Strader, a 5-year DPW employee. She filled potholes in the summer and cleared snow and ice from the roads in our winter, just making it safe for people in the city of Detroit to use the streets every day. She had a big personality, a great laugh, and she's somebody that our Department of Public Works is very much going to miss. And yesterday, we lost Dennis Haynes, who was a Detroit Water and Sewer Department field tech. He was the guy on the emergency water breaks where the water would back up into your basement. Dennis was the person who came out, got it fixed, sucked the water out so that you could use your home again. And a U.S. Navy veteran, tremendously professional, and is another loss to this community. 10 City of Detroit employees that we have lost in the last 4 weeks, and it makes us all the more grateful to see Chief Craig walk in here and go back to work. But our families, our thoughts are with the families of the Strader and the Haynes families. Numbers today, if you look at them, at first they look disturbing. We have 538 Detroiters who have died from this virus. That number is up 69 from yesterday. That would be our largest number, except it appears 36 of those came from an intense state review of old death certificates. And of those 36, only 2 or 3 were in the last week. Some of them date back to March 25th, and I talked about this yesterday. And Dr. Jonae Khaldun has just done a remarkable job trying to deal with this data issue. She and I talk almost every night where I'll call and say, hey, I know it looks like the cases are down, but the lab's backed up. Or she'll say, I know it's going to look like the deaths are up, but we cleared out a backlog. And in this state, we have not had a process for the hospitals to be committed to timely report this information. And Dr. Khaldun has been fighting this every step of the way. And you can imagine the hospitals being slammed, the person remembering to send into the report to the state hasn't always done it. But with the addition of these 36 cases that the State Health Department has caught up on, and Dr. Khaldun has secured a commitment from the hospitals now that things are easing, that they will commit additional staff so the information will be timely. And so I just want to say it's been a hard thing to get this cleaned up, but I think Dr. Khaldun, has it largely solved, and I expect the data to be significantly better going forward. I deeply appreciate everything that she has done to address this. As far as the numbers in the city, again, it's all trending the right direction. Hospitals are all reporting that their caseloads are easing, that the ventilator usage is easing, and we are now 1 week since the 1,000-bed TCF Field Hospital opened up, and they still are at 16 patients, the same as yesterday. They thought they'd be at 250 by the end of the first week. It is truly remarkable what the people of this city have done in supporting the governor's social distancing orders. It's made just a huge difference in everybody's lives. One thing I would say to folks is this, is we are starting to see some of the demand for testing at the fairgrounds go down. And you can get in and get tested tomorrow. We have room for everybody. There's 30 doctor's offices on the city website that will take you as a new patient right now. I want to make sure everybody in this city who has any symptoms at all gets tested. And I want to get everybody who does have symptoms tested, because we're going to start now to look at the possibility by next week of potentially opening it up maybe to the essential workers who are having to go to workplaces every day because of their jobs, and start to broaden it even to those without symptoms. But right now, anybody in this city who has a cough, who has a fever, who's having any trouble breathing, please call your doctor. It is very easy to get a prescription. It's very easy to get out to the site. You'll be through it in probably an average of 15 minutes. And this is the key. We need to know who has this virus and who doesn't. Special thank you to the Henry Ford Health Systems for supporting us on our nursing home initiative. And we're now putting even more resources into this. So Dr. John Zervos, who you've seen, Dr. Mark Zervos, who's our official advisor, head of infectious disease for Henry Ford, his son is running the outreach program for the Henry Ford Health System. He's a doctor, and he's going into the nursing homes as well. We are going through every single one of the nursing homes now. We're identifying who is short of protective equipment. We're going to get them that protective equipment. We are going back on every one of these tests to make sure that the patients are properly cared for. And I can't say enough about the job that Dr. Najiba Rahman is doing as the medical director. She's personally been out at these nursing homes talking to people, and I'm just really proud of the fact that the head of our health department's medical staff has got such a hands-on approach to this. Right now, our biggest concern on coronavirus in this city are our patients in the nursing homes, and we're going to do everything we possibly can to protect them. And the outreach effort is made possible in part by a $150,000 donation by United Way, and we're also joined today by Dr. Darian Driver Hudson, who's made a lot of that possible. I'm going to give Dr. Hudson a chance to talk about United Way in a minute, but before that, I think a lot of folks in this community have been wishing him well for a while, and we'll want to hear from our police chief, who's officially back on the job, Chief James Craig.
Thank you, Mr. Mayor. It is, I can smile, I'm excited. It's certainly been a journey, but I really just want to thank Detroit for your outpouring of prayers, well wishes, certainly the DPD family. I got so many I want to thank, but I'm going to go through that first because I think it's very appropriate to do so. You know, when you're fighting a deadly disease, one of the things that gets you through is the people that are reaching out and touching you daily. And I want to start first with Mayor Mike Duggan, who didn't miss a day, called me every day, checking on me. So that was inspirational. And I really want to applaud him for his leadership. You know, when you think about people that sit in these seats of leadership, we have to make decisions. Some agree, some don't. None of us, I don't care who you are, none of us have had to deal with anything like this. You've heard me say, you know, some of the crises I've dealt with over almost 44 years, earthquakes, civil unrest, mass shootings. But let me just say, there's no textbook on this. And when you assume leadership positions, making the right decision really does matter. And certainly our mayor has done that. I will tell you, when we were first starting to quarantine members from the department, it was the absolute right thing to do. I know it saved some lives in our department, but we were very aggressive about it. But one of the things that certainly was a challenge is getting them back to work. So it was having an impact, but we never had any disruptions in service. But the mayor went out, reached out to Abbott Labs, and we got this rapid test. And let me tell you, here's the good news. 709 sworn and civilian employees returned to duty. All of the people that we moved out of support units to backfill patrol slots are back in their support units. So I want to say thank you to the mayor, and not only for, you know, going out, showing the leadership and initiative to get the rapid test, but also recognizing our first responders, some of which sit in our dispatch centers, getting hazard pay. That was a big deal. Certainly want to thank, one of my assistant chiefs, Chief White, for being on the ground during this critical time and assuming the role for day-to-day operations. So I really want to thank AC White and certainly the executive and command team that has just done a phenomenal job. But most importantly, and I will always say it, people in the DPD know, I always say cops count, leadership matters. And when I think about our police officers, the men and women on the front lines who, despite this crisis, this unknown enemy, who go to work, and those that have been quarantined, wanting to get back out to join their colleagues in this fight and keeping our city safe. They truly are the heroes. Those who also reached out, and I know I'm going to miss a few, but I want to talk about, Wayne County Executive Warren Evans, who reached out during this time, Wayne County Prosecutor Kim Worthy. Several of our judges have reached out, Sheriff Benny Napoleon, our U.S. Attorney Matthew Snyder, certainly my LAPD, CPD, and PPD families across this country, and certainly the residents of those cities who really reached out and encouraged me each and every day. And then I want to talk a little bit about Henry Ford Hospital. I was connected to Henry Ford. Certainly Dr. Makara, who is the chief clinical officer of that hospital, personally assisted me, called me daily to check on me, and certainly was ready to put me in the hospital at a moment's notice. But one of the things that, through this journey, this fight, one of the things I did not want to do, I didn't want to go to the hospital. I wanted to fight from home because I knew there were many others that certainly were in greater pain, greater need than I. I was just fortunate that I was able to recover and fight the good fight in quarantine from my home. Right now, I want to take a moment to acknowledge certainly our two losses that we've experienced since the start of this crisis, but also the 9 members who are currently of the DPD who are still in the hospitals fighting. And I want to also include in that those who are at home fighting. What oftentimes doesn't get talked about is our members who are on oxygen still. They might not be physically in hospitals, but they're fighting a good fight. And so I just ask all for prayers and support for their full recovery. And I just want to thank Detroiters. I've been staying closely connected with what's been going on. Even at the height of my illness, Assistant Chief White would keep me briefed. But really, I want to thank Detroiters for their compliance, staying home so we can stay alive. And certainly that matters. I know I've had several from our community reach out, some of our activist members who pledged their support in honoring the governor's stay-home order. And then lastly, but certainly not least, we've heard a lot about our grocery employees over the last several days. Certainly want to thank them, but our mail carriers, UPS, FedEx, Amazon, and certainly our gas station, the employees who work in pharmacies, because they're out in the front lines as well. They're exposed, and so I just want to really give them honor at this point. But real briefly, and it's been talked about, this journey was a special journey. This enemy, this unknown enemy that we fight is real, and it affects us all in different ways. If I could leave our viewers, our listeners with one thing, fight. Fight. The one thing that I learned 44 years ago in police academies, both in Los Angeles and here in Detroit, fight to survive. And that's one thing when we think about our police officers, when they're involved in a critical encounter, if you don't have the will to survive, more times than not, you won't. And so that's part of the wiring, but you fight to survive. I know I've heard countless stories of some of our residents who are at home, bedridden, get up, move around. I've listened to the doctors. I know my own experience that Had it not been, and certainly not always on the wise counsel of my family and the doctor, go easy on working out. I'm an avid fitness person, but I know my body. And I know in order to overcome this virus, this deadly virus, I needed to punch back. It will consume you. It wants to take over. But if you let it know you're in charge, you can win this. And so I'm just encouraging anybody going through this fight, stay prayed up and fight back. And last, I just want to talk a little bit. I already talked about the 709 who are cleared. As of today, we have 338 that are quarantined, both sworn and civilian. Of that number, 257 are sworn, 81 are civilian, and so we're definitely moving in the right direction. So again, I want to applaud the leadership of the department that really has taken a heightened posture in making sure our employees are safe. They're wearing masks in the field, they're cleaning the vehicles. Those things are making a difference, and undoubtedly, it's saving lives. So at the appropriate time, I take whatever questions you have. But again, Mr. Mayor, thank you for your leadership.
It's great to have you back. One of the positives out of this crisis has been heroes have emerged. And one of those heroes is Dr. Darian Driver Hudson. When this hit, and lots of people with big hearts called up and say, how can I help? On the healthcare side, Dr. Hudson and the United Way of Southeastern Michigan said, we'll take the lead. And they have been phenomenal. When we wanted to send nurses out to check on our homeless twice a week, they helped fund that. When we wanted to help our restaurants and deliver meals to our first responders, they helped fund the Feed the Front Lines program. 6,000 meals delivered already, 18,000 over the next couple weeks for 150 restaurants. We help both the restaurants as well as the workers. When we realized that the water shutoffs were, all the ones that could be turned on were turned on, but we had people with major plumbing problems inside their house, it was United Way that stepped forward with funding to help fund the plumbing repairs inside the houses. When we needed food for seniors, they were there. When we needed rides to the fairgrounds, they helped out. And so I think every once in a while we have to stop and say thank you to some of the real treasures of this community. And so, Dr. Hudson, I'd like you to talk about what you've done and what people can do to continue to help.
Thank you, Mayor Duggan. Good afternoon. First, I just want to say a very special thank you to Mayor Duggan, to Alexis Wiley, and the team from the city of Detroit. They have been fierce advocates for the people in our community. We have been on the phone day in and night, trying to work through this pandemic and this crisis. And if there is one comfort, it is knowing that we do have such a fierce advocate that's working for all of the people in the city of Detroit and across our region. Chief Craig, it's wonderful to see you here as well, and our prayers have been with you. I wanted to just start, I have to thank my team. There are a lot of people that are working through this crisis. I'll be talking to you all today about 211. I have a number of my staff members whose families have been impacted by this virus, and just wanted to make sure that everyone knew that we all need to stay in prayer constantly, because this is closer to home than I think anyone could possibly have imagined. Our focus continues to be on making sure that all of our homes, all of our community members are stable, and that our children are still able to thrive even in the midst of this crisis. When this started, we pulled together with over 30 corporate, philanthropic, and individual donors to create the Community Response Fund. Up to this point, we have been able to raise now $9.5 million for our community. As Mayor Duggan was referring to a number of the initiatives that we're doing in partnership with the city of Detroit, that number is now up to $870,000 that we've been able to award. We've been able to support 45 agencies that are within the city of Detroit proper, and there are another 210 agencies, if you're looking at all of the agencies that we've been able to provide support to. This does include school districts and helping with virtual learning opportunities, and also includes child care providers who are providing those critical services for those on the front line. We still need everyone's help in being able to raise dollars. 9.5 million might sound like a lot, but it actually isn't when we look at the needs that we have across our community. Those who are able, and any amount that we have that anyone gives can go to good use. We are asking that you consider giving to text COVID to 51555 or go to unitedwaysem.org/COVID. We're currently trying to get more resources for protective equipment for all of our nonprofit agencies and our volunteers who are out in the field. $5 buys a mask. $25 can get gloves. $50 can get hand sanitizer. We've been able to provide resources to a number of agencies that many of you all know in the community: Brilliant Detroit, Downtown Boxing Gym, DPSCD, Focus Hope, Alternative for Girls, just to name a few. But the needs are still out there. There is a number of people who are working to donate equipment. We've received a number of resources now from Plymouth Technology and Havilland Enterprises. They're donating 1,000 gallons of hand sanitizer a week to be able to get to those on the front line. So we need you all to still communicate with us what those needs are. I'm mentioning agencies, but we are also helping individuals. These are the agencies that people have been going to get help. We know that 74% of our Detroiters have been in need prior to this pandemic, and so these needs continue to grow. These organizations are here to provide support to you. I did want to mention some of the resources that are available with 211. This is our information and referral call line. It's just 3 digits that you have to remember. Calling 211 connects you to 1,300 agencies that are in our community. These agencies focus on rent and utility assistance. They will connect you to the food distribution sites, as well as a number of community shelters. We have received a significant uptick in the number of calls. It's pretty much doubled since this pandemic has started, but we are still very much receiving calls from the community. It's open 24 hours a day, 7 days a week, and again, this is 211. You can also go online to unitedwaysem.org/211. There are a number of resources. You only have to type in your zip code, and it will connect you to resources that are in your community, as well as resources at the city and the state levels. This includes resources for our dislocated workers, as well as those who are trying to find materials for their students while they are out of school. And this is connected to the COVID 313 website that the city has put up as well. Other things that we need your help with is still trying to get volunteers during this time. We have about 25 frontline agencies that are still operating and providing face-to-face services during this time, and volunteers are needed. You can go to that same website that I mentioned. There are a number of volunteer opportunities. All you have to do is click on volunteer, and you'll be able to see those different opportunities. We still need blood donations from our community. We know a number of the hospitals, the American Red Cross. I know my sorority, Delta Sigma Theta, has been very active in doing blood donations. We still need more of those and encourage you to participate. There are also a number of virtual volunteer opportunities that are available. Wayne County is one example where people are able to call and provide comfort and support to our isolated seniors in our community. There are so many ways that people can lean in. Oftentimes people think that you have to have money to be able to help, but that's not true at all. If you have time, even just 5 minutes, 10 minutes to give to help others, we need it now more than ever. Our motto at United Way has been staying apart but standing united, and we stand with the community at this time. The information that you're hearing every day is sobering. I know sitting here, listening to it, it is sobering, but we are still working very hard. We will not rest until we get through this pandemic. Your United Way is here to support you, and Mayor Duggan, Chief Craig, just know that anything else that you need, we are here ready, standing to assist. Thank you.
Thank you for the great job you have done, Dr. Hudson. And, You know, we are continuing to see, as we get the feedback from the hospitals on a daily basis, that this disease is going down in the city of Detroit. And the person who's been leading our effort, our health director, Denise Fair.
Thank you, Mayor. I also want to begin by welcoming back Chief James Craig. I saw him walking in, and I said that he's looking good and feeling good. So it's really good to have you back. And I also got my selfie with you, with my mask on. Your mask too, yes. I also want to recognize our long-standing partner, United Way. They have been so helpful for the city of Detroit, for our community, and also for the Detroit Health Department. So with that, I say thank you for your continued support. So let me switch gears, as I always do, and share the cases for today. We are now at 7,387 cases and 538 deaths. These aren't just numbers. These aren't just cases. These are people, people who we love. Those are our loved ones, our family, our mothers, our fathers. And I know on Facebook, when I scroll, I always see these pictures of people, and my heart goes out to those families who have been impacted. As I always mention, the numbers will continue to increase because of our testing efforts, and I really hope that Detroiters are continuing to listen to us to make sure that they are following our guidelines. So I realize that there tends to be, again, a focus on just the numbers, but the fact is people are recovering every day. Those people like Chief James Craig. Many have mild symptoms, and they're able to recover right at home without a lot of medical care. And they are returning to work with some sense of normalcy. And again, Chief Craig is an example that COVID-19 can be beaten. And I suspect many of us also know someone who has recovered. And if you do know someone who has recovered, please celebrate them and let us know. We want to hear those powerful stories. And again, there continues to be lots of hope. Now, I share these daily updates because I want you to know that COVID-19 is real. This is not a game. COVID-19 does not discriminate. It has impacted all of us across all spectrums. We need to take this seriously. We need to continue COVID-19 prevention efforts, making sure you're wearing your mask, you're washing your hands, you're disinfecting those highly touched objects, and of course, staying at home, except if you're going to the grocery store or to the pharmacy. So please continue to follow those guidelines. We need to stay the course a little while longer so that more of us can continue to recover. So with that, I'll turn it over to you, Mayor.
And one last note, we've lost 538 people. I did a phone call last night with about 30 or 40 block club leaders, and one of them shared their story of having lost her mother and not being able to have a funeral. And of course, I lost my father, and we were not able to grieve. And she made a suggestion that I think we're going to do. There's 538 families who have not been able to go through the traditional process where your loved ones could gather. And we are going to plan a special memorial in this city to remember those that we've lost. And I'm asking Rochelle Riley to lead that planning. It's going to be a few months from now before we can get together again. But for members of this community who want to be part of planning a memorial service where we celebrate the lives of the people we lost. This is something that we're going to start to focus on. I think it's very important as a city. And with that, we'll take any questions.
Hi, everybody. This question's for the chief, and it's very nice to see you looking so well. Thank you. I've got two for you. Is there any remediation, whether it's disinfecting cars or putting antimicrobial spray or anything like that, that would be helpful right now, that could be donated to the department? We get calls all the time from businesses who are interested in trying to help out first responders. Is that something that you would be looking for right now? Is it something that is needed?
You know, in talking to Assistant Chief White, we are fully stocked. However, we do accept donations, and as you know, because we're cleaning these vehicles every couple of hours, and we're going through the disinfectants, the hand sanitizers, whatever someone wants to donate is perfectly fine. We could use it. And because we have, a 24-hour, 7-day operation. So we go through the materials quite frequently. But right now we're good, but that could change, so we'll accept it.
The other question would be, with still, certainly less than there were in quarantine, but still a sizable amount of the department is still in quarantine. How are you managing? How is everybody managing? I know they're managing to the best of their abilities, but are there certain strategies that you have to, now that you're back, that you are looking at and thinking, okay, we've got to do A, B, and C?
And that's a great question. We started this work very early on. We didn't wait. We do it, we're constantly, I call it a constant state of readiness. When this pandemic first came on scene, we thought of the worst case scenarios. I always use this as a great example. When you look at what happened in communications with the 911 call taker, we didn't know initially what the cause of his death was. Ironically, the same day we learned it was COVID, we immediately responded to make others in communications safe. But the good news was, and the mayor supported me on this was when we purchased our $8 million communications facility as part of our build-out at headquarters, we also launched a backup system. Can you imagine what would have happened if we had to shut communications down? We would have literally locked out every emergency call from this city. It would have gone back into the dark ages of calling a local police station and saying, I have an emergency. And the calls or cars are dispatched right from the police station. That's just one example. In terms of staffing, we early on saw the impact that quarantines were having on our staffing and patrol. So we very quickly looked at our support units and moved them in. The great news is we moved maybe 80 staff and spread them out throughout the department. They're all back in the specialized units. And our response times are at the lowest, and we haven't had any disruptions. Now, that doesn't mean we have our feet up. Every day we are talking, making assessments on our staffing, but there's been no disruption to service delivery, and that's so critical. So we're on top of it, and in fact, we're not reactive, but we're very proactive in how we address this issue.
Thank you.
Thank you.
Mr. Mayor, I watched your address this week on the financial situation. What's the feedback you've been getting about the plans that you are suggesting be put in place here?
I think the great majority of city employees know exactly what category they fall into now, and the response has been very professional. Nobody wants to hear their hours are going to be cut, but I think the fact that we kept the health care for every single full-time employee, that we said we're going to keep you on at least part-time because we want you back as soon as this passes, and when people realized what a good job the federal government did with the supplemental unemployment to get people at least through July without taking a significant financial hit, I think most employees understand, and certainly the feedback I've gotten is an appreciation that none of our full-time employees lost their health care during this pandemic. I think that hit home with a lot of people.
Thank you.
Good afternoon. Question for the chief. First, Chief, I don't know how closely you monitored these news conferences the last couple of weeks. Jim Kurtzner with Channel 7. We had discussions with the mayor about people who gathered in the city at gas stations in some neighborhoods. They were ignoring the stay home, stay safe orders. Now that you're on the backside of your own case, what's your message to those people?
We still want, and I think I addressed it in my remarks, I really applaud Detroiters. We have gone out and investigated a number of locations, groups of people in parks, gas stations where basketball hoops were erected. I will tell you, people respond, they're not pushing back, but now people are self-correcting their behavior. That's something that we're starting to see. It's not like they're trying to challenge us. They recognize the seriousness of this, And it typically is more young people, and so we remind the young people the importance of, look, stay safe, stay alive, stay home. And they're doing that. And that doesn't mean we're going to have calls that we need to go out and investigate, but they've been responsive.
I have a question for the mayor. Mr. Mayor, I talked to a couple of the pastors today in town, Reverend Charles Williams, Pastor Horace Sheffield. They're involved in the food distribution now. Some National Guard troops were working yesterday, but they have since been pulled out of there. You have sent in some Public Works employees to fill those positions. They're confused. They're thinking that this was done because the Guard has a bad connotation going all the way back to the 1967 riots. Can you clarify why they were pulled and what role you played?
So I'll start with this. I have enormous respect for the National Guard. When they reached out to me for a field hospital, I worked with them to get the field hospital set up at the TCF Center, and the National Guard, supporting the Army Corps of Engineers, did an outstanding job. The first I heard about this was 5 o'clock last night. We got a call from the governor's office, and they said Pastor Williams was, had a problem. We didn't say anything about Horace Sheffield, but they said Pastor Williams had a problem, that he'd made a commitment on food distribution, and he couldn't get enough volunteers from his church to unload the trucks. And they were coming in the morning. Did we have people to help? And if we didn't, the governor could get the National Guard. And we said, no, we've got people. They'll be out there. And Pastor Williams told Alexis Wiley he needed 10 people at 9 in the morning to solve this, and we had 15 people at 8:30 in the morning. And so we did what we were supposed to do. All this drama about in or out, all I know is they called us at 5 o'clock last night. We had people there this morning, and I just have great regard for the National Guard.
So it occurred because you were able to fill those positions with your DPW workers. It didn't have anything to do with the perception or the optics that the Guard would be delivering meals in the community where they were involved in the riots.
Again, there are a lot of people in this community who have a memory of the 1960s that's still painful and is still stressful. And National Guards come in to cities in a deliberative process between the governor and the mayor, which is exactly the process we had on the TCF Center. They don't come into cities when a church doesn't have enough volunteers that day. And so I want to make sure, as I have with the governor, that when we need the National Guard, we collaborate, and they're here. They do a great job. But a minister doesn't call in the National Guard. That's just not how it works.
Thank you.
Other questions?
Yes, we've got questions from a number of reporters who are watching remotely. From the Metro Times, they like to know if we have any sense as to why Michigan's death rate from COVID is a lot higher than surrounding states.
You know, I don't know if we're higher or we're earlier. I think time is going to tell. There was a point at which Washington was higher than us. It was clear that the Seattle area was earlier, but they handled it. I don't think anybody expected that a week into the field hospital of 1,000 beds, we'd only have 16 people. You look at what's happening now in Massachusetts, Pennsylvania, Illinois. Are we going to end up higher, or are we just earlier? You'd have to ask an epidemiologist that question, but my guess is that if you ask us a month or two, we'll have a better answer on that.
Okay. Michigan Radio would like to know if we've got any updated numbers on the infections at nursing homes, deaths from COVID at nursing homes, and how many nursing homes have been tested.
So we're testing 1 or 2 nursing homes every day. We're still running a 35% infection rate. It's the same, but we're finding deeper problems. We're finding nursing homes where the staff does not have the appropriate personal protective equipment. We are now, right now, going nursing home by nursing home, making sure they're staffed and staging a major intervention. And we can give you daily updates. Again, Dr. Khaldun has done a great job of updating the data, but a lot of times a hospital reports a death. That information doesn't include that they got transferred to the hospital from a nursing home. And so one of the data challenges that we're all working through is to get to that information. But I want to give it to you when I have it accurately.
Okay. Sean Lay from Local 4 would like to know if you have any response or reaction to some of the images that were on CNN the other day from Sinai Grace Hospital with the way some of the victims' bodies were stored.
Yeah, I talked to Dr. Gregory about it. She said the pictures were from 2 or 3 weeks ago. Every hospital system I know of has had to get additional refrigerated storage units to handle the bodies in a respectful way until the funeral homes start to operate. That's true of every big city in the country. It hasn't been as bad here as it has been elsewhere, where they had to dig mass graves in the park on a temporary basis. But as far as I understand, I've talked to all the hospitals, they've arranged appropriated refrigerated space until the funeral homes reopen.
Okay. WWJ would like to know if we have updates on about how many Detroiters have used the list of 30 doctors that we put up on the website to be able to make appointments.
A huge number. I'd have to call each of the 30 doctors' offices, but I hear from people every day that says, I have a doctor now, and this is a good thing. We need folks who got a primary care doctor for purposes of a prescription to stay with that doctor for all of their health care, but I know a lot of people have called their doctor as a result of this.
Okay. ML Elric from the Free Press said that officials in other cities have expressed concerns that there won't be an adequate supply of swabs when testing needs to scale up even more, and wants to know if you share those concerns, and second of all, if you have given up on the idea that these 200,000 swabs are coming.
Yeah. I never believed that 200,000 swabs were out there. We are 2-3 weeks ahead on our swab supply. Boise Jackson, the procurement department, have done a great job. Dr. Roberto Romero has been unbelievable in putting together test kits for us, and a lot of others have made donations. So we are in good shape on test kits. We're always running a couple of weeks ahead, and we're starting to have conversations about what does restarting work look like. My responsibility is going to be for city departments, and we are right now evaluating every single city function, what can open up safely first, and before we open up anything, we're going to test everybody in that department before they go back to work. And so we're evaluating what we're going to need. It will be a lot more testing than what we've seen in the past. You may end up doing blood testing to see if you have the antibodies. Chief Craig has volunteered to do the first blood test, in addition to the ongoing Abbott 15-minute tests. But right now we're good. We're really good on everything. We accept donations, but the way this is going, you want to always have 2-3 weeks supply, because we had days there where we were scrambling one day to the next. With all the donations and all the support, we're in reasonably good shape right now.
Okay, a couple questions from Crane's Detroit Business. First one is, do we have an estimate of how much the city has spent so far on COVID response?
Dave Masseron can tell you that, but it's millions. But we expect that to be reimbursed by the federal government under the CARES bill. So our direct expense, things like testing and the like, we expect to be reimbursed.
Okay. One question from Fox 2. They and another outlet have reported that COVID deaths in the past month are more than 2 years of homicides in the city, and wanted to know if you have any thoughts or perspective on that or reflections.
This has been terrible. Every homicide hurts. I know the chief and I take it as a personal failure. And certainly in the last 4 or 5 months, we haven't been happy at all about the trend of the violence. But it's hard. And it's as Denise Fair says in that numbers, 10 of our fellow employees we've lost, and a lot of people close to me, and probably a lot of people close to everybody in this city. But if you look at where we thought it was going, the day they built those 1,000 beds at TCF Center, I thought those 1,000 beds were going to be filled. So did everybody else. The people of this city have saved a lot of their neighbors' lives by the social distancing that they've done. And we've done it without having to close parks, without having to do curfews. The people of the city have just been wonderful in the way they've embraced each other.
Okay, and the last question comes from Cranes again, and that is, there have been some concerns about people discarding masks and gloves, into parking lots and on the streets. Is that something that is a concern to the city, and anything?
It is. I've asked Hakeem Berry, our chief operating officer, to take a look at that, because I've had that concern raised by different members on the different community calls I've done, and Hakeem's working on that right now.
Okay, no more
Anybody have any
questions.
other questions? All right, thank you.